ICRF is a nonprofit organization consisting of physicians, scientists, and volunteers dedicated to supporting innovative cancer research. With chapters in Montreal, Toronto, New York, Chicago, Los Angeles, Connecticut, and Israel, ICRF has raised more than $74 million and funded over 2,500 cancer research projects. Almost 1 in every 2 Canadians is expected to be diagnosed with cancer in their lifetime, and 1 in 4 Canadians will die from the disease. On average in Quebec, someone learns that they have cancer every 9 minutes. Every 23 minutes, someone dies of it. Cancer is the leading cause of death in Quebec. And that was before COVID. While we adapt to the COVID tidal wave, cancer remains with us. COVID reminds us that our healthcare system needs brilliant minds and well-trained hands. Our most vulnerable communities rely on our doctors and their teams more than ever. And this is why science matters.
COVID-19 has impacted all facets of life, particularly here at the hospital. You have to walk around the hospital in protective gear. You touch a lot less, and sometimes the touch is very important for a patient, particularly those who are suffering from cancer. The times I speak to patients, more often than not, is done via this type of medium, via a video or by a phone call. And in cancer care, it's really difficult to have a meaningful discussion over the phone or by video.
Here are the masks. Okay, we're ready to roll. In terms of the work in the COVID area now, we try to be more social distancing. We had some outbreak on our floor, but all in all, I think that McGill is adjusting to the new situation.
I'm part of a team of 3 orthopedic oncologists who work at the University of Montreal, Maisonneuve-Rosemont and Sainte-Justine Hospital. We are responsible for helping with the diagnosis and the surgical management of sarcomas, which are cancers that touch the bone.
We're starting to return to do urgent oncological surgeries, although it is still limited due to the fact that in our main hospital there are a lot of COVID patients.
One of the problems is maybe 10-15% of the cases we have to operate are going to stay in the hospital 3 to 4 weeks. Some of the patients we're operating are at risk. If they contract COVID, they may very well die. So we don't want delays in cancer treatment. Luckily, we're starting to get control a little bit of the hospital. We're fine-tuning it as we go. Somebody said we're building a plane as we're flying it.
The hospital does not really feel like a safe place, because you have to protect yourself from an invisible enemy which lives mostly in your head, and you need to try to be strong. None of us felt that we wanted to interrupt our research in cancer. So we had to reorganize the lab.
We have to recognize that all our labs have suffered as the funding of cancer research has plummeted, as the resources, rightfully so, have been deviated towards this pandemic.
We still need to figure out a way to do cancer research. That hasn't disappeared with COVID. That's probably became even worse.
The overall theme of our reaction to this pandemic has always had a thread of worry about the cancer patients. It's not so much that I want to be protected against the virus for my own safety. The most difficult thing is trying not to be the person who's going to infect someone who's undergoing chemotherapy, for example, who is very vulnerable.
The COVID pandemic has definitely been very hard on the cancer community, not just because they're immunocompromised, but I think their access to care has probably changed a lot.
We understand we are in unprecedented time. Even though we need to concentrate on identifying and treating this current pandemic, we have to recognize that cancer is going to be with us as we navigate these infectious pandemics.
There is some, for sure, overlap in corona on oncology. Nowadays, we treat the late stages of corona with immunosuppressive drug, which was really anti-cancer treatment. I'm beginning to consult our oncologist really to help me with the treatment with corona.
The other positive is that people realize that science is the answer here. And so a lot more investment in science are happening.
Private funding and philanthropy is central to the entire cancer research ecosystem. It's a poorly kept secret that Israel punches massively over its weight in all of life science research because it's such a phenomenal source of innovation.
I'm very confident that there'll be vaccines and treatments, and our children will look back on this as an experience, definitely, but one that science solved, and then we'll be better ready for the next pandemic.
My passion is my way of being. The way I express myself and interact with the world. The way I do this is by being a healthcare provider. Although it's true that research and technology are helping cure more and more people, it remains fundamentally important never to forget that it is the caring that heals, even more in difficult times like now. I think we're in a very stimulating era, the same way that during the plague, people turned to God. Today, people turn to science. The same way we turn to science to take care of COVID and help us through this, we can count on science and on all of the molecular therapies that are ongoing and proliferating every day with new immunotherapies, new oral treatments, that finally we're getting more and more patients cured with cancer.